So Safe Passage is what is known as a fully co-located child advocacy center. We are the one and only in the state of Colorado that has achieved this best practice model. And the reason that that matters is because each of the key agencies that is needed to help a child achieve safety and healing has stepped forward and committed to being in the same space, working side by side down the hall from each other every day. It's a big commitment, right? Each of our agencies has different mandates and responsibilities, so the fact that we can work seamlessly together to expedite the process for kids and families is really important. Across the United States, there are over 900 child advocacy centers, and only about 20% of them have achieved this co-located model. It's certainly a source of pride for Colorado Springs.
Co-location gives us all the opportunity to provide a higher level of service and support, giving the child and their family a place to begin to heal.
DHS caseworkers, we talk to kids and families every day. So when it comes to working on an MDT and having a possible criminal investigation, what really is great with this MDT process here at Safe Passage is the children and the families, they only have to tell their story once. And so that really helps with minimizing the trauma of having to relive that story multiple times, and really for all of us to get the same information at the same time. Also, it's really helpful when all of the different professionals are able to be at the same table with the parents, with the caregivers, so we can talk through our different roles, and so they understand what's gonna happen next, and even us as a team, we can make good decisions around what needs to happen next to support the family through this. It's awesome to be able to see that we can get services in place right away, or even just brainstorm how we're going to support this family after this unfortunate thing has happened with their family.
Anytime we can keep a child out of a busy emergency department, but still give them the opportunity to speak to a medical professional, or even have a medical exam done by someone who's been trained in how to care for children who have been affected by sexual assault or abuse, we think that's a positive. Safe Passage is a fantastic location for this. We have multiple disciplinary partners here, including us as the medical staff. And since we've been here, we've been able to communicate with over 400 families and children.
With co-location, there are so many mental health services and supports that are available to families and children, from initial crisis response to ongoing counseling and support groups, as well as coordination with other agencies so that families have seamless services in one place.
The reason I believe it's important to have a co-located facility is that it's easier on the families and it makes it much less of a stressor for them and is much more convenient.
The co-location, really the collaboration, is the most significant growth and improvement that we've made in many years. And it's because it's truly what's best for kids.